Hello, and welcome to your healthcare guide. Do you ever have trouble keeping track of your doctor's information? Do you know the benefits of going to the doctor versus the emergency room when you're sick? Do you need help figuring out how to apply for Medicaid? This demonstration will show you how the healthcare guide can assist you with all of your medical needs. To demonstrate how the guide works, let me introduce Chris. Chris is now 18 years old and has been in the foster care system since he was 13. He and his foster parents were introduced to the healthcare guide during a visit to the Czech clinic when he was 15. The doctor introduces all of the different information in the guide that he'll need to know when he's older, and even lets him pick out his own cover. She helps Chris fill out all of his past immunizations and current medications, so he'll always have them handy. She then holds on to the guide while he's living with his parents, and when he's old enough for independent living or emancipation, she gives him the guide to use on his own. When Chris turns 18, Chris is excited to be on his own in his own apartment through an independent living service. While this means more freedom, it also means more responsibility for all areas of his life: rent, food, transportation, and healthcare. While reading through the guide, he notices he's way overdue for a dentist appointment. Not knowing where to begin, he consults the guide, which gives him a list of clear, easy instructions on how to make a dentist appointment. The guide informs him of all of the necessary documents to bring, as well as contact information if he has any important questions. He is then feeling confident and prepared, and successfully completes his first independent dentist appointment. One morning in the winter, Chris wakes up and feels awful. He has difficulty swallowing, his glands are swollen, and he has a fever of 102 degrees. Being by himself, Chris is lost on how to take care of himself. He contemplates going to the emergency room since that's the easiest decision he can think of, but instead he checks his healthcare guide, remembering there's a chart to help him self-diagnose. After finding all of his symptoms in the chart, he realizes that he should make an appointment with the doctor. Chris takes the guide's advice, calls the doctor, and successfully schedules an appointment. He takes a bus over to the doctor's office and gets diagnosed with strep throat and needs to take antibiotics. When he filled out his healthcare guide, he wrote down the name, address, and phone number of the closest pharmacy and gives that information to the doctor. The doctor then calls in his prescription so it will be ready for Chris on the way home. After successfully taking his medication, Chris begins to feel better in a couple of days. Thanks to the healthcare guide, you'll never feel lost or confused when it comes to your healthcare again.